Reported 36 psychiatric patients who were transferred from the Life Esidimeni Health Institution in Randfontein earlier this year have died. The patients were relocated to non-governmental organizations after the contract between the facility and the Gauteng Provincial Health Department ended. Nxumalo's sister is one of the deceased. Even though she allegedly died on the 17th of August, Christine was only informed of her passing a week later. She joins us in studio, and she's also joined by Dr Mvuyiso Talatala, I beg your pardon. He's a psychiatrist who used to consult at Life Esidimeni, and he's also, if I'm not mistaken, the chairperson of the Psychiatric Council.
Of the Society of Psychiatrists.
Okay, the Society of Psychiatrists. Thank you for joining us, and welcome to the program, Christine, and please accept our deepest sympathies before we even speak about anything. Let me begin with you, though. You heard of the passing of your sister a week after she passed. Now, she was at Esidimeni. Where was she relocated to?
Well, I received an SMS that said she was moved to Cullinan. So we knew her to be in Cullinan. When I got the call from the, I suppose, the owner of Precious Angels NGO, she told us that she had been moved there 6 weeks prior to the 25th for specialized treatment. So that was the first I knew of that.
I mean, the circumstances of her passing, do you know any details?
I think that's what's traumatizing. It's because I don't know. I haven't even seen where she was or the facility where she was at. Because every time I ask for the address, I don't get it. I've been getting a runaround for, I don't know for how long, since I heard.
So the last, just to get it straight, the last you heard she was at Esidimeni, then she was relocated somewhere else.
To
you
Cullinan.
Didn't know where that somewhere else was?
I knew about Cullinan.
Okay.
I knew about Cullinan, but I didn't know the transfer from Cullinan to the Precious Angels.
Okay, and then the next thing you heard is that
She's
she
passed
away.
Yes.
Let's, Dr. Talatala, you are a psychiatrist at Esidimeni and you consult there. You know, the circumstances there, was it fair to remove all of the patients from there? Do you think, from your assessment, do you think it was the right thing to do?
Morning again, Leanne. Just a slight correction. I actually did not work there.
So you didn't consult there?
I didn't consult there. I used to transfer patients there. I worked at Nxumalo Hospital.
Okay.
That used to send patients there.
Okay.
And of course, I'm also speaking as the president of the Society of Psychiatrists.
Yeah. Obviously, the industry is quite small, so you would hear. I mean, what are the circumstances like at Esidimeni?
Yeah. Well, I would not say that it was an ideal place to keep patients, but with the resources that we have, it was a reasonable place to keep patients. And I'm not speaking here on just on behalf of Life. I'm not even sure if they would still want the patients back. I'm just speaking from the point of view of the society. The ideal, of course, would be to discharge patients to their own communities, to their NGOs in their communities, but the manner in which it was done, we anticipated that it would lead to problems.
Yeah. There were reasons that the health department decided to cancel the contract. I mean, we heard the health MEC yesterday saying that there were some circumstances. I mean, they're saying that I think the word she used was honky-dory. I think that's what she said. And she said that some patients were leaving with one set of clothes, one set of shoes. It was a really not a good situation at all, and they needed to move out of there. But the situation and the way in which they were moved, I mean, do you know much about it? Do you think it was done well?
I think we should separate what happened at the time of discharge from how things were alive all the years. There is no facility, mental health facility, including the state facilities that are hunky-dory. If you can go to Charlotte McClegg or Helen Joseph, it's not ideal. Patients don't live under ideal circumstances, but we do work with those facilities. What was a problem in this instance is how the patients were actually moved from that facility. It's actually the transfer process that was a problem, because a huge number of patients were discharged in a short period of time without proper preparation. And we had returned to the MEC as the Society of Psychiatrists in June last year when we heard of the rumor. And we said we want to discuss this transfer of the discharge of patients from Life Esidimeni, because we anticipated that there would be unintended consequences. When she made the announcement in October, we wrote to her again and say, let's meet and discuss so that we can be partners in the process, because we anticipated problems. I mean, one of the issues that has been mentioned is that there are no files were not transferred from Life Esidimeni to the NGOs, you don't even need a transfer of files. The expectation by the Mental Healthcare Act is that when a patient is discharged, there should be a Form 3 field. This the government should supervise through the review boards. Why were the patients not discharged with their Form 3s that will detail their medications? Also, a standard discharge summary is what any health facility should do.
Yeah.
Why did the patients live with that? Why was it not supervised that patients live with that discharge summaries that will detail how the patients are, what medications been tried, and
Indeed.
what medications
and
they
the,
are on?
and the stories are that a lot of them did not have that, hence perhaps leading to these 36 deaths. Let's just delve a little bit more into your sister. What was wrong with your sister? What was she diagnosed as having?
She was diagnosed with Alzheimer's.
Okay, so she had Alzheimer's. When did you hear that she was being transferred? Because a lot of the families are saying that they weren't even told that their family member was being transferred, and then the next second they couldn't find them.
Yes. I got an SMS on the 30th of June that stated the facility is closing today. She's being transferred today to Cullinan.
Okay.
That's basically how it went.
When you say Cullinan, did they give you the name of the institution?
It said Cullinan Center.
Okay. Could you track her down at the Cullinan Center?
At first, no. They didn't. They said she wasn't there. Then they said I must try 2 other NGOs within the center. And I found her on the register of Anchor NGO. The lady in charge there is Dorothy.
Yeah.
And then Dorothy said, it's a male institution. So there's no ways they could have put her there. So I had to then phone the other institution, and then the other institution said, no, she wasn't even on the register. Went back to Cullinan, and then Cullinan actually confirmed that she was there.
Then from there she went to the next NGO.
And that was decided upon amongst themselves, yes.
Amongst themselves. Nobody told you about this?
Nobody told me.
You had no idea. She was just transferred?
Literally from Cullinan to this precious NGO.
May I ask you, is it not the right thing to do to consult with a family? I mean, as far as I know, you don't mess with a patient without the consent of a family member.
Well, but if you're going to transfer patients in buses, then you may not have time to do that.
But is that the right thing to do?
The standard...
You're dealing with people, you're not dealing with animals. I mean, I hate to say it that way, but the way you're saying it is as crude as that. I mean, you're bus loading people from one place to another. You're dealing with lives here.
In fact, it should not even be the staff of the Department of Health that are actually meeting the families as the treating team, the multidisciplinary team that is treating the patients at Life Esidimeni should have been given enough time to meet with the families and tell them we are discharging you home or to an NGO. That is the basic thing to do for any patient.
Now, I do know, just on a final closing note, and again, I just want to, Christine, speak to you. I know that the MEC and the Gauteng Health Department has said that they would assist with funeral arrangements for those that have passed away. Have they been in touch with you? Have they helped you in any way?
You know, I've been getting this question over and over again. The Department of Health has not done a single thing to help me or my family. I had to track down my sister all on my own. I had to go to the police to get my sister's body released. I had to ask the police to actually do an autopsy because the circumstance in which she died was just... So, no, Department of Health has done such. Absolutely nothing.
All right, Christine, I'm so sorry to hear this. We have got the MEC here. She's coming up next. We're going to ask her these questions, and I'm hoping that we can get something for you out of this, because to lose a sister, lose a family is hard enough, but to have it under these circumstances,
exactly.
I'm really sorry for you. Christine Nxumalo, her sister is one of the deceased from these institutions that were transferred, and Dr Mvuyiso Talatala is a psychiatrist talking to us about the situation and how it should have actually been done. So let's take a break. The MEC is our guest straight after this. Stay tuned.